Hi, I'm Dr. Jacquelyn Burrell, and I'm a naturopathic doctor working with underserved communities in Flint, Michigan, and in an integrative clinic in Burlington, Vermont. The seed to my health journey was planted at a pretty young age. I grew up on Lake Michigan in an old growth forest, and I spent a lot of time outside. I love to spend time mountain biking, running around with my friends, playing at the beach, and I felt so much joy and excitement at just being outside whenever I could. I brought that love of nature with me as I, grew up and began to decide, what do I want to do with my life? When I was about 19, I found an opportunity to go live on an organic farm for a summer. And that is sort of where a lot changed for me. I found this deep, deep connection with the soil, with plants, with animals, with the cycles of sun up, sun down, and just truly living in that connection with nature every day. From there, I learned about herbalism. I learned about the nutrient density in organic foods and how great you can feel when you combined this natural way of living with how you are in your daily life. In my own personal life, I really need integrative medicine. Being a new practitioner is pretty stressful, and dealing with the come down of the long years of medical school, I realized I needed to put my own health first as well. And for me, that looks like going on long, meditative, soothing runs, doing yoga every day as much as I can, and maintaining my connection with healthy food through high-quality ingredients found at my local farmers markets. Going, smelling, touching, trying new foods, and finding ways to find joy in my life every day. I really wanted to work at a clinic that had the same values that I have in medicine, and I wanted to use my skills as a naturopathic physician and work integratively with other providers. The clinic I'm working at not only has naturopathic doctors and medical doctors, we have acupuncturists, we have nutritionists, we have mental health counselors, and we have massage therapists. And when we all work together, we really find the best tailored individual plan for a patient and their needs. On top of working in this integrative clinic, I'm extremely passionate about using my own privilege to help underserved communities. I've been working with Dr. Joe Pizzorno on a project in Flint, Michigan, where we're helping pre-diabetic patients reverse their diabetes successfully and also reduce the toxic burden for that community. We're not only working with diagnostic lab testing, but we're helping the lifestyle of these patients. We're connecting them with local farm CSA boxes where they're getting fresh, healthy vegetables every day. We're teaching them how to use these vegetables for their health. And we're setting them up with the foundation so that they can go back to their primary care providers with the knowledge that we've distributed to them. And when we do this, we're setting them up for not just a temporary solution, but a lifestyle change, and that is the goal of integrative medicine. Communities like Flint, Michigan are not unique. This is happening all over. When we all use our own individual privilege to bring back our education and knowledge to these communities, we're doing a greater good for that community. And we're setting them up for reduced incidence of disease and reduced burden of chronic disease. In my project with Flint, we're working with 2 medical doctors on the ground, and we're working with community leaders in the town already that have built that trust and foundation needed to get the physicians and the practitioners and the patients to really trust each other. When you're working that way, when you're doing it from the heart with the knowledge that you have, it comes so naturally. And the first step is just to try it. Try talking to different practitioners. Build those connections on your own, and I think that integrative medicine really just becomes medicine.